Nocturnal enuresis is basically night-time urinary incontinence. So it's a night-time urinary incontinence in a children. Nighttime urinary incontinence, and that occur 2 times per week, and the children has that symptom more than 3 months, and the age of children must be more than 5 years. So nocturnal enuresis is divided into the two types: primary and the secondary nocturnal enuresis, right? So primary mean the child never achieved urinary continence, while in case of the secondary nocturnal enuresis, the child has a history of the continence for at least 6 months. Okay, next let's so primary nocturnal enuresis. So primary nocturnal enuresis. So it is a without prior prolonged period of continence. The child has no history of the continence, urinary continence, and the causes of the primary nocturnal enuresis, the brain maturation delay, and the genetics. The typically the child has the family history of the nocturnal enuresis. So the primary nocturnal enuresis pathogenesis is very simple. That is a delayed maturation of the bladder control and increased nocturnal urine output. That may be the increased evening fluid intake, increased evening fluid intake, and decrease ADH. And the last one is decreased bladder capacity. Again, the most high yield one, whether it is a primary nocturnal enuresis or the secondary nocturnal enuresis. So urine analysis is the initial evaluation, and that is a very important and high yield one. So the management of the primary nocturnal enuresis is a simple, that you reassure the parents of the that child, and the behavioral modification, it may be decrease evening fluid, or restriction, and scheduled widening. Child should go the toilet before the sleep, and bedwetting, alarm, and desmopressin. So the behavioral modification is a first line of treatment, while bedwetting and desmopressin are the second line, are refractory. The case are refractory to the behavioral modification. Then we move to the desmopressin bedwetting alarm. Okay, so new secondary nocturnal enuresis is basically the new onset of the urinary incontinence after achieving continence for more than 6 months, right? So causes the underlying medical condition, that may be the UTI and diabetes mellitus and psychological stresses. And again, the most high yield one is a urine analysis, that is initial investigation for the nocturnal enuresis. So secondary nocturnal enuresis management is again the treatment of the underlying condition, that may be the diabetes mellitus and the UTI. For UTI, you give the antibiotics, right? So in case of the children, that is a third generation cephalosporin. Third generation cephalosporins. Right. So behavioral modification, again the behavioral modification, decrease evening fluids are scheduled widening.